Myself, Dr. Priya Pradeep, Professor and Head, Department of Roganidhana and Vijnana, Yenepoya Ayurveda Medical College and Hospital, Naringana, would like to present on a topic, Nadi Vijnana, the tool for diagnosis. The objective of my study is the definition of Nadi Pariksha, description regarding the importance of Nadi Pariksha, description regarding the methods of eliciting the Nadi Pariksha, describe the clinical interpretation. Ayurveda is an ancient system of medicine used for centuries and practiced in various parts of India with a unique method of diagnosis and treatment for various kinds of illness. Nadi Pariksha is one of the method of examination of the patient mentioned under the heading of Ashtavida Pariksha. So, Ashtavida Parikshas are considered to be the 8 types of Rogi Parikshas, and they are Nadi, Mutra, Malam, Juha, Shabda, Sparsha, Drak and Akriti. Nadi is said to be the first one. It is mentioned that Karasya Angushta Muleya Damani Jiva Sakshini Tat Cheshtaya Sukham Dukkam Jneyam Kayasya Pandite. Karasya Angushta Mule means the pulse of the patient has to be examined at the wrist. That indicates the evidence of the life in the body. The physician should recognize the health and ill health of a person observing its activity. You can see in the picture, it has to be examined by the use of index, middle and the ring finger. The word meaning of the Nadi implies so many other meanings other than pulse, like Tantu, Hamsi, Damani, Sira, Snayu. But actually the word meaning of the Nadi implies that which enables a hollow to flow. When we look into the historical background, the huge propagation of Nadi Pariksha is started from Yoga Shastra and Siddha Shastra. The philosophical knowledge of Nadi Pariksha is transferred from Shiva to Brahma and then to the Indra and finally to the Kanada. The pulsation and its palpation of the life can be traced from 6000 BC in the Roman, and the Greeks also contributed in the pulse diagnosis. In Indian medicine, Nadi has considered as a means of diagnosis and was brought into the practice by the Acharya Sharangadhara during the 13th century. And it is said that during the medieval period of the Mughal century, and there was a culture that the ladies should not show their faces other than their husbands. So that is why, to rule out the probable diagnosis, this Nadi Pariksha has been established. Nadi Pariksha gained its importance during the 17th century by Yogaratnakara through the addition of 48 shlokas. So this concept of Nadi Pariksha is also found in other ancient books like Basavarajiyam, Bhava Prakasha, Nadi Pariksha by Ravana Samhita and Nadi Vijnana by Kanada. Both Ravana and Kanada is considered to be the research scholars in the field of Nadi. There is a mythological story that when the Ravana is forcefully taking Sita Ma to the Lanka, he held her at rest and could able to feel her wrist and considered that she is suffering with an annullatory cycles. So that's why she made her to sit in Ashokavana. Because of the effect of the Ashoka Vrakshas, her cycle became clear and she was able to deliver the twins after returning to Ayodhya. Nadi Pariksha's Vidhi. Yogaratnakara says the examination of the Nadi is to be performed as that of the exploration of the germs. It is so important. Unless the physician is well versed in this technique, he cannot get into the conclusion. The site of the examination, Nadim Angushta Muladya Sprashe Dakshinage Kare Jnanartham Rogino Vaidyo Nija Dakshina Paninaha. For the examination of the Nadi, patient and the physician has to be sit in the erect posture. The right hand of the patient has to be in the flexed and in the relaxed posture. The elbow of the patient has to be held by the physician's left hand and the physician's right index, middle and the ring finger has to be kept in the patient's right hand just below the thumb. You can see in the picture the index finger, middle finger and the ring finger kept in the close opposition just below the thumb. The right hand of the male patient and the left hand of the woman is examined by the right hand of the physician, because it is said that Kurma chakra located in the nabi that faces Urdhvamukha in the females and Adhomukha in the males, that is responsible for the pulsation at the wrist. And it is also said that when the person has more male energy, right nadi will be more prominent. And if the female energy is activated, then the left pulse will be more prominent. That is why right hand of the male patient and the left hand of the female patient has to be examined for the nadi. And it is also said in the Samhitas that in a pregnant woman, if the fetus is male, right nadi will be more prominent, and if the fetus is female, left nadi of the mother will be more prominent. The radial pulse, that is nothing but the Hasta Nadi, is usually chosen as the site to read the pulse because it is most convenient to read and it is more readily available when comparing to the other pulse sites. It reveals the status of dosha dushti, agni, the nature of the disease and the expected prognosis. In Basavarajiyam, 8 site has been mentioned for the Nadi Parikshas other than the Hasta Nadis, like 2 at Angushtamula, 2 at Gulfa, 2 at Kanta Pradesha and 2 at Nasa. When to examine the Nadi? What is the time duration? Vega or rate of the pulse varies due to the exercise, anxiety, exertion, food, daily variations or the day-to-day variations in the doshas. To get an accurate pulse, read the pulse in the early morning in the restful condition is considered to be the ideal one. There are certain criteria has been mentioned how the Vaidya should be, what are the qualities he has to possess before examining the Nadi. Sthira Chitta Prasannatma Manasacha Visharada, that means a physician should have stable mind, that is Sthira Chitta. Prasannatma means pleasing mind. Manasacha Visharada means clear mind which is devoid of all the stress. He should be and one more thing is very important, that he should be very expert in assessing the Nadi. Some of the contraindications are mentioned for the Nadi Pariksha. Sadyah Snatasya Bhuktasya Tata Snehavaghahinaha Kshutrashartasya Suptasya Nadi Samyak Na Buddhyate. That means the Nadi Pariksha should not be done in a patient who have just taken bath or immediately after the consumption of the food, who is afflicted with hunger and thirst, just after the exposure to the sun, just after the exercise, after doing the abhyanga or immediately after awakening from the sleep, or during such periods, Kaphadi doshas will be vitiated in the body and there is a chance that these doshas will alter the pulse. That's why during all these conditions, the Nadi should not be examined. So these are the qualities if Vaidya possesses, he should not do the Nadi Pariksha. What are they? Pita Madhyascha Chanchalatma Malamutradi Vega Yuktam Nadi Jnane Asamartaha Styal Loba Akranta Kamukha. That means a physician who has drunk alcohol or unstable mind, who does the Mutra and Malavega Dharana, does not have the knowledge of Nadi Pariksha and greedy, should not do the Nadi Pariksha at all. So these Rogis are considered to be ayogya for the Nadi Pariksha. They are Dhruta Margasya Vishwasa Rahitam Ajnata Roginam Vinabhishamsana Vaidyo Nadi Duschakila Vashihi. That means one who is wicked, non-trustworthy, whose gotra is not known, who do not trust the signs and who do not trust the physician who is attending the patient, in whom the Nadi Pariksha should not be done. How the Nadi Gati will be? Sukitasya sthirajneya tata balavati smrata. It is mentioned in Sharangadhara Samhita, Purvakanda. The pulse of the healthy individual is steady and forceful. The movement characteristics of the pulse are narrated in comparison with that of the various movement of certain animals, birds like snake, leech, frog, pigeon, crow, swan, peacock, elephant, and so on. Regular rhythms of the nadi are mentioned as samagati and the irregular as vishamagati in the classics. You can see in the picture the movement of the leech and movement of the snake can be considered to the movement of the vata. The pitta gati of the nadi will be as that of the movement of the frog and as that of the crow. Kafaja can be compared to the movement of the or the walk of the pigeon and the swan. According to the text, the vata nadi which is perceived over the index finger of the physician is superficial, cold, light, thin, feeble, and empty. With the more pressure, it disappears and is having vakragati resembling the movement of, as I told already, that is snake and the leech. The movement of the pitta pulse is full with a strong throat. It is hot and abrupt with a high amplitude with a good volume and considerably hot. It is best felt under the middle finger and resembles the movement of manduka, that is the frog, and the movement of the kaka, which will be hopping and jumping in the nature and was explained with the words the chapala and utplutyam. The slow movement of kapha pulse, which is deep, slow, wavy, cool in touch, and is sensed by the ring finger. And the movement of this nadi is compared with the movement of the swan and the kapota. Emotional factors plays a major influence on the gati of the nadi. So gati gets increases by the lust and the anger, and on the other hand, the nadi gets slow due to the increase in the sorrow and the fear. Sharangadhara has related the speed of the nadi to the digestive fire and said that nadi will be fast when the agni is get active and the nadi will slow down when the agni is weak. This indicates that increase in the metabolic activity increases the nadi gati. Now we'll look into the basic principles of Ayurveda. The three humors of Vata dosha, Pitta dosha and the Kapha doshas are collectively called Tridoshas, and they control the basic physiological functions of the body along the sub-doshas to maintain they are considered to be the principal doshas. The catabolism of the body is believed to be governed by the Vata, metabolism by the Pitta, and anabolism by the Kapha. For a healthy state of the healthy body, a balance between these three doshas and the other factors like Dhatu, Mala and Agni should be maintained. Any imbalance between these three factors causes a state of illness or the diseases in the body. To understand the vector, the more closely we observe, the more we understand. Suppose a person has a problem with many Vata symptoms. Which subtype of the Vata dosha is involved? Whether the pulse reveals whether it is a prana, whether it is a udana, samana, apana or vyana. The quality of the pulse is also important. The text have explained the significance of pulse properties, but in qualitative manner, which is always subjective. Now you can look into the picture. The index finger in which we can feel the pulse of Vata nadi. It is further subdivided into 5. The first one that indicates the prana, next one is the udana, then vyana, then samana and apana. Like that, the middle and the ring finger can also be divided into 5 areas by which we can feel the other 5 subtypes of Pitta and the Kapha dosha. So these are the few examples in which consider that the subtypes of the Vata, if it is spikes under the Vataja finger at the prana site, can denote a migraine type of headaches, ringing in the ear, the dizziness or some mental dysfunctions such as chattering of the brain, thinking too much, or the insomnia, interrupted sleep, or too many dreams. Pulse, which is felt at the Kledaka Kapha and the Apana Vata, denote the disorders like the nephrotic syndrome. By palpating the nadi at the different levels like superficial, deep, the prakriti and the vikriti avastha conditions of the avayava or the body parts and the manobhavas can also be known by palpating these nadis. Prakriti is considered as one of the basic constitution established at the time of conception, and it is read at the 7th level, that is the deepest level. Vikriti is to be read, that is the state is read, that is the Vikrita Avastha or the dosha, diseased state, that is felt on the first or the superficial level of the finger. How to come into the prognosis, or by palpating the nadi, how we can assess that the person is nearing to die, or the disease is able to treat, or it is very difficult to treat. It is mentioned in the classics that Hanti cha sthana vichuta stitva chalati ya sa smrata prananashini atikshina cha shita cha jivitam hanti samshayam. That means, as per the literature, nadi, which is intermittent in nature and it is sensed indications other than the specified place, indicates to be fatal and lead to the early death of the patient. Now we'll come to the conclusion of the topic, that is, Ayurveda is well known for Nadi Pariksha, and the classical texts have emphasized its significance in the assessment of the doshas, which are the basis of the disease diagnosis and prognosis. The speed, the stability and gati of the pulse, that is vary with the aggravated doshas. Pulse based diagnosis is objective and it is subjective and it is highly dependent on the skill of the patient. Without the proper skill, the Nadi Pariksha cannot be performed effectively. These are some of the references from which I have taken. Thank you.